Good evening, doctors. Welcome again. Today we are going to discuss about MCQs for NEET PG, AIIMS PG, for jipmer PG, for Indian PG's exams. Treatment of alcohol dependence is by all except. You can pause this video, take at least 30-40 seconds to answer, not more than 40 seconds. So think which is the best answer. So here the best answer is accept, that is flumazenil. Why? Flumazenil is used in benzodiazepine poisoning, whereas disulfiram used as anti disulfiram used as aversion therapy, and naltrexone acamprosate is for anti-craving drug. Okay, flumazenil is a benzodiazepine antagonist. Okay, 40-year-old female came to the OPD with complaints of depressed mood, insomnia, loss of appetite, lack of interest in surroundings for the past 1 year. These symptoms appeared after loss in business deal 1 year ago. What is correct regarding management? So, firstly, you have to think what is this patient is suffering from. So, the patient is suffering from depression here. Okay, so guys, pause this video, take 30-40 seconds and try to answer. So, the best answer here is antidepressant should be given based on the side effect profile. Okay, the history is characteristic of depressive disorder. Antidepressant drugs are to be given, but there are no ideal antidepressant. The treatment should be based on side effect profile of the drugs. Okay, drug used for treatment of nocturnal aneurysms. So guys, pause this video, take your time. So the best answer here is imipramine. Imipramine is the best answer. Okay, let's discuss. Aneurysm alarm system are the preferred treatment for children for nocturnal aneurysms. You can read all these systems. Motivation therapy. Child is rewarded for keeping dry at night, but punishment for bed waiting is discouraged. There is limited evidence to support the efficacy of this approach. Okay, drug therapy includes desmopressin is a preferred drug given at night to reduce urine production during sleep, whereas tricyclic antidepressant like imipramine can also be used, but use is limited due to side effects. Okay, most common cause of premature death in schizophrenia is, think the best answer, pause this video. So the best answer here is suicide is the best answer. Okay, let's discuss. Life expectancy of patient with schizophrenia is decreased by approximately 15 to 25 years. Suicide is the most important cause of premature death in a patient with schizophrenia. There is 20-fold increased risk of suicide compared to general population. Suicide attempt may occur without warning or expression of intent. Cancer is the second most frequent cause of mortality in schizophrenics. The rates of metabolic syndrome and cardiovascular disorders are also increased, which is not a cognitive dysfunction. So think which is single best answer. Answer is thought block is not a cognitive dysfunction. Okay. Cognitive dysfunction refers to the errors in the processing of information in the thought process. Thought block is an error in the continuity of thought. Okay. Which of the following is seen associated with alcoholic paranoia? That is, answer here is delusions. Alcoholic paranoia is an alcohol-induced psychotic disorder. It is characterized by delusion, mostly of persecution, jealousy reference. Auditory hallucination may also be seen. Okay. All are features of autistic disorders except. So think, I will give you time. So the answer here is visual impairment. Okay. Autistic disorder characterized by impairment of social interaction, disorder of communication and language, as in delayed development of speech, stereotypic movements. Visual impairment is not seen in autism. Somatic passivity is seen in. This is mainly seen in paranoid schizophrenia. In paranoid schizophrenia. Okay. Somatic passivity is a Schneider first rank of schizophrenia. The drug of choice for obsessive compulsive disorder is. So drug of choice for obsessive compulsive disorder is fluoxetine. But the best therapy is cognitive behavior therapy. Okay. Drug of choice, yes, we discussed. 18-year-old student complains of lack of interest in studies for last 6 months. He has frequent quarrels with his parents and has frequent headaches. The most appropriate clinical approach would be to. So here we have to rule out depression. Why? Let's discuss. The given features are not something that may be considered as a normal adolescent problem. Also, the headache described here cannot be classified under migraine. Oppositional defiant disorder often present at a younger age. Hence, it is necessary to rule out depression. Delusion is a disorder of. Think. Best answer. Delusion is a disorder of thought. Hallucination is a disorder of perception. Okay. All of the following are associated with better prognosis in schizophrenia except. So, negative symptoms, we never see better prognosis with negative symptoms. It's rare. Intense nihilism, somatization, and agitation in old age are the hallmark symptoms of. So, guys, think which is the best answer. So, best answer is involutional melancholia. Mutism, a kinesis in a person who appears awake and even alert is best described as. So this is best described as stupor. Okay. Bright light treatment has been found to be most effective in the treatment of. So this is effective in treatment of seasonal affective disorder. Seasonal affective disorder refers to episodes of depression that occurs every year during autumn or winter. Symptoms improve in spring and summer. Okay. Rivastigmine and donepezil are drugs used predominantly in the management of. This is mainly used in the treatment of dementia. Let's discuss. Rivastigmine, donepezil are cholinergic stimulators. They are used in the treatment of Alzheimer's disease, the most common cause of dementia. Preservation is. What does it mean? So pause this video, think the best answer. The best answer here is persistent and inappropriate repetition of the same thought. Persistent inappropriate repetition of same thoughts. Preservation, same thoughts. Okay. One of the following usually differentiate hysterical symptoms from hypochondrial symptoms. Okay, so think which is the single best answer. So the single best answer here is symptoms do not normally reflect understandable physiological or pathological mechanism. Okay. Hysteria or conversion disorder is a condition in which a person has blindness, paralysis, or other nervous system neurologic symptoms that cannot be explained by medical evaluation. Hypochondria is a belief that physical symptoms are signs of serious illness, even when there is no medical evidence to support the presence of an illness. 18-year-old boy came to psychiatry OPD with a complaint of feeling changed from inside. He described himself as feeling strange, as if he is different from his normal self. He was very tense and anxious, yet could not point out the precious change in him, the phenomena best called as. So, this phenomena we can say depersonalization. Depersonalization. Okay. 25-year-old female present with 2-year history of repetitive irresistible thoughts of contaminated with dirt associated with repetitive hand washing. She reports these thoughts to be her own and distressing, but is not able to overcome them. Along with medication, she is most likely to benefit from which of the following therapies? So, we can say cognitive behavior therapy or exposure and response prevention. Exposure and response prevention. Okay. Naltrexone is used in opioid addiction because naltrexone used because of it prevent relapse due to prevention of relapse. Most common substance abuse in India, you all know very well. People like to chewing tobacco chewing tobacco, even smoking tobacco, BD, cigarette, gutka, lot of misuse. Second one is cannabis. Okay. The drug which is used for long-term maintenance in an opioid addiction is, in case of long-term maintenance, we have to go for methadone, treatment by methadone. Following is not a atypical antipsychotic. It's a very easy, but you have to memorize atypical antipsychotics. They are asking not. That is thioridazine is not a atypical antipsychotic. Okay. 30-year-old man who was recently started on haloperidol 30 mg per day developed hyperpyrexia, muscle rigidity, akinesia, mutism, sweating, tachycardia, increased blood pressure. Investigation shows increased WBC count, increased creatinine phosphokinase. This is no history of any other drug intake or any signs of infection. Most likely diagnosis here is, so the cause here you see it's very easy. Hyperpyrexia means hypothermia, muscle rigidity, akinesia, mutism, sweating, tachycardia, increased BP, increased WBC count, increased creatinine phosphokinase. It indicates neuroleptic malignant syndrome. Neuroleptic malignant syndrome. A patient with acute psychosis who is on haloperidol 20 mg per day for the last 2 days has an episode characterized by tongue protrusion, oliguric crisis, stiffness and abnormal posture of limbs and trunk without loss of consciousness for the last 20 minutes before presenting to casualty. This improved within a few minutes after administration of diphenylhydramine HCl. The most likely diagnosis is, so this is a case of acute dystonia where akathisia means restlessness. Okay, neuroleptic malignant syndrome we already discussed, muscle stiffness. hypothermia, etc. etc. Okay. A middle-aged person reported to psychiatric OPD with the complaints of fear of leaving home, fear of traveling alone, fear of being in a crowd. He develops marked anxiety with palpitations and swallowing if is in these situations. He often avoids public transport to go to his place of work. The most likely diagnosis is so, the most likely diagnosis is agoraphobia, means phobia to being in a public places, crowded places, okay, and claustrophobia, closed space phobia, okay. Now, 5-HIAA is a metabolite of serotonin. This is a metabolite of serotonin, okay. Loosening of association is an example of. So, this is an example of formal thought disorder. Formal thought disorder. Okay. Delusion is a disorder of. Delusion is a disorder of thoughts. Thought disorder. Okay. So guys, I already finished with psychiatry MCQs. If you have any queries, any question, you can ask me. If you're new on my channel, please subscribe it. And if you like this video, put like on it. Thank you. Good day. Goodbye. That's all for today.